A full retrospective on effectiveness, mandates, safety, and the DNA debate. In 2020, the world changed. A microscopic virus shut down economies, overwhelmed hospitals, and took millions of lives. Then, faster than anyone thought possible, a vaccine was developed. Not just one, but several. They were hailed as modern miracles. Governments rolled them out, celebrities endorsed them, and mandates were issued to protect society. But here we are, years later, with a clearer view. So let's ask the real questions. Were the COVID vaccines effective? Were they rushed? Should they have been mandated? And do they alter or affect our DNA, as some still believe? In this video, we'll examine the science, the communication, the politics, and the consequences, all with one goal: understanding the truth. Because whether you were vaccinated or hesitant, boosted or skeptical, you deserve to know what really happened. Let's break it all down. Were the vaccines effective? Let's start with the core question. Did the vaccines work? To answer that, we need to separate two ideas: preventing infection and preventing severe illness and death. When Pfizer and Moderna released early trial data, they reported around 95% effectiveness at preventing symptomatic COVID. This was based on trials in late 2020 before major variants had emerged. In the early rollout, those numbers seemed to hold. Hospitalizations dropped among vaccinated groups. Countries that vaccinated quickly saw dramatic decreases in death rates. But then came Delta, then Omicron. And suddenly, vaccinated people were testing positive. Did the vaccine stop working? Not exactly. They just weren't as good at preventing infection from these newer, more contagious variants. Here's the real-world data. A CDC study from 2022 showed that 2 doses of an mRNA vaccine offered about 60–80% protection against hospitalization from Delta. With Omicron, that protection dropped, especially without boosters. Protection against infection? Much lower. Often under 30–40% after several months. But what about deaths? According to a UK government report, vaccinated individuals, especially those with boosters, had far lower mortality rates even during Omicron waves. So the vaccine's original promise, protecting life, held up. But the messaging often confused the public. People were told, get vaccinated to stop the spread. Yet they got vaccinated and still caught and transmitted the virus. That disconnect between scientific nuance and public messaging may have done more damage than any virus mutation. Should mandates have happened? In 2021, the vaccine rollout became more than a medical effort. It became a political flashpoint. Cities, companies, and governments introduced vaccine mandates. Some required vaccination for air travel, others for employment, school, or even entering restaurants. The idea was simple. The unvaccinated posed a risk to others. Mandates would push us closer to herd immunity. Everyone would be safer. But were they right? Let's be clear. Some mandates were based on outdated assumptions. If the vaccines couldn't fully prevent transmission, then the logic of you're endangering others by not being vaccinated lost some weight. Still, there were practical reasons. Vaccinated people were less likely to end up in the hospital, meaning less burden on healthcare systems. Mandates increased vaccination rates, at least temporarily. But the public backlash was massive. Protests erupted. Workers were fired. Legal battles began. In the U.S., the Supreme Court ruled against a sweeping federal vaccine mandate for large employers, citing overreach. Many cities scaled back their rules. Others stood by them. Here's where it gets tricky. Public health is about collective safety. But mandates tread the line between safety and freedom. Were they necessary? In some settings, like nursing homes or hospitals, many argue yes. But in others, like outdoor events or private businesses, the justification weakened over time. Mandates may have saved lives, but they also damaged trust. And trust is hard to rebuild. Were the vaccines rushed? The COVID vaccines were developed in under a year. To some, that was a triumph. To others, it was terrifying. So, were they rushed? Let's examine what really happened. First, the technology. Pfizer and Moderna used mRNA platforms, a type of vaccine that had been researched for over a decade for cancer and other viruses. So while new to the public, this wasn't some overnight invention. Second, the process. The FDA and global regulators used a method called rolling review. Instead of waiting for a company to finish all trials, they reviewed safety and efficacy data in real time. Also, trial phases were overlapped, not skipped. Tens of thousands participated in Phase 3 trials. Manufacturers began producing doses before full approval, at their own financial risk. So yes, the timeline was compressed. But were corners cut? Not in the scientific process, but perhaps in communication. What wasn't tested long-term was durability, how long protection would last, or rare side effects that might show up in smaller groups. That data, by definition, could only come later. And when side effects like myocarditis in young men appeared, particularly with mRNA vaccines, some health agencies were slow to respond. This delay added fuel to skepticism. So were they rushed unsafely? No, but they were deployed under emergency conditions. And the speed, while necessary, made many people understandably wary. Do they affect your DNA? One of the most persistent myths during the pandemic was that COVID vaccines, particularly mRNA ones, could alter your DNA. Let's break this down clearly. What is mRNA? It stands for messenger RNA, a tiny strand that gives your cells instructions. In this case, the message is, make this harmless piece of the virus so your immune system can learn to fight it. Now here's the key point. RNA never enters your cell's nucleus, which is where your DNA is stored. It's like a delivery truck dropping off a package outside, but never entering the building. Once the message is read, the mRNA is destroyed by your body. It doesn't linger, and it cannot integrate with your DNA. So where did this fear come from? A few early lab studies, conducted in highly artificial environments, showed fragments of mRNA entering the nucleus under extreme conditions. These were taken out of context online and used to suggest DNA changes. But this doesn't happen in real-life vaccination, and no large-scale study has found any DNA alteration from mRNA vaccines. In fact, if mRNA vaccines could reprogram your DNA, they'd be revolutionary for gene therapy, not just disease prevention. So, no, COVID vaccines do not alter your DNA. This myth has been thoroughly debunked by virologists and geneticists around the world. What we got right and what we got wrong. It's easy to look back and critique, but it's also important to acknowledge what went right. We developed and delivered vaccines faster than ever before. They saved lives, especially among older adults and the medically vulnerable. Global collaboration reached new heights in science and logistics. But we also made mistakes. Public messaging was overconfident and sometimes misleading. Officials failed to adjust communication as new data emerged. Trust in science was politicized, weaponized, and sometimes lost. Perhaps the biggest failure wasn't in the science. It was in the transparency and how it was communicated. So were we misled? Some promises were overblown. Some decisions were made too quickly, and some information came too late. But the science itself, it was imperfect, but not deceptive. The bigger issue was trust. And trust is earned, not mandated. Now it's your turn. What do you think? Were vaccine mandates worth it? Would you take another mRNA vaccine today? Comment below. Let's have an honest conversation, not a fight. Thanks for watching. Stay curious, stay thoughtful. Like and subscribe for all things AI.